Is your HbA1c in the pre-diabetic range? Here's what that actually means and what you can do about it. Getting a result like that can feel alarming, but understanding the numbers is the first step. And the good news is there's a lot you can do. So let's start with the basics. HbA1c is a blood test that measures your average blood glucose levels over the past 2 to 3 months. It's not a snapshot of one moment. It gives a much broader picture of how your body has been managing glucose over time. In the UK, the NHS uses specific thresholds to interpret these results. A reading below 42 millimeters per mole is considered normal. A reading of 42 to 47 millimoles per mole falls into the prediabetes range, also called non-diabetic hyperglycemia. And a result of 48 millimeters per mole or above may indicate type 2 diabetes, which would then require a second confirmatory laboratory test in people without symptoms. So if your result sits between 42 and 47, your blood glucose is higher than it should be, but it hasn't crossed the threshold for a type 2 diabetes diagnosis. That distinction matters because it means there's still time to act. Now, one important point about how this test is done. For diagnosis, HbA1c must be measured from a venous blood sample analysed in an accredited laboratory. Home testing kits and point-of-care devices aren't used for diagnosis. So if you've used one of those, speak to your GP about getting a proper lab test. It's also worth knowing that HbA1c isn't the right test for everyone. If you're pregnant, under 18, or if type 1 diabetes is suspected, HbA1c isn't appropriate. And in that last case, urgent clinical assessment is needed. It's also not reliable if you have a condition affecting your red blood cells, such as iron deficiency anemia, hemolytic anemia, or certain hemoglobin variants, as these can falsely raise or lower the reading. In those situations, your doctor may use a fasting plasma glucose test or an oral glucose tolerance test instead. Alongside HbA1c, fasting plasma glucose is also used in NHS referral pathways. A fasting glucose reading of 5.5 to 6.9 millimoles per litre is commonly considered alongside your HbA1c when assessing your risk. Now, what can you actually do with this information? The encouraging thing is that prediabetes is often reversible. Sustained changes to diet, physical activity, and weight management can bring HbA1c levels back into the normal range for many people. If your result falls in the prediabetes range, you may be eligible for referral to the NHS Diabetes Prevention Programme, also known as Healthier You. This is a free NHS programme designed to support people with non-diabetic hyperglycemia through structured lifestyle guidance. It's worth asking your GP about this specifically. When you speak to your doctor or healthcare professional, ask what your result means in the context of your overall health, whether a fasting glucose test is also appropriate for you, and whether a referral to the NHS Diabetes Prevention Programme would be suitable. And please don't try to interpret these results in isolation. Always speak to a healthcare professional who can look at your full picture. So, to recap, the prediabetes HbA1c range in the UK is 42 to 47 millimoles per mole, as defined by NICE and NHS England. Diagnostic HbA1c must be a venous laboratory test, not a home kit. HbA1c isn't suitable for everyone, including in pregnancy under 18S or where type 1 diabetes is suspected. And prediabetes is often reversible, and lifestyle changes and NHS support can make a real difference. This video is for general information only and isn't a substitute for medical advice. Always speak to your GP or healthcare professional about your results. If you found this helpful, leave a comment below, especially if you have questions about understanding your results. Give this video a like if it was useful, and subscribe to Bolt for more straightforward health information. We'll see you in the next one.